So basically, in previous class, we talked about fever, hypothermia. Okay. Today we are going to talk about generalized fatigue, means generalized weakness. So nowadays it is common. So everyone is feeling weakness in some part of the day, in some part of the life, or even in some part of their during work period. So basically, uh, it is one of the most common symptom in all type of diseases. Okay, and it is one of the challenging thing that we have to choose what type of problem, what type of disease is suffered by the patient. Okay, so it is one of the common symptoms in all the type of diseases. It is one of the symptom only. Okay, but we have to diagnosis that what is the cause of fatigue. So it is a very broad, very long distance thing. Okay, we have to understand, we have to take deep history of the patient, and we have to examine the patient, and we have to check the pulse, and we have to see the all the parts of the body like eyes, tongue, nails. All this will give the indication, and it will guide you to one of the cause of the fatigue. Okay. So basically, I will divide fatigue, generalized fatigue, mostly due to the in the electrohomeopathy, we will divide into three types. Okay. Three types or four types. Okay. So we'll proceed the book also, but here in the electrohomeopathy, I will divide the fatigue or generalized weakness. What does weakness means? First, we will understood. Then we will enter into the types of weakness. Okay, so basically, fatigue or weakness mean low energy level. What it means? Low energy level, or person feeling that he cannot able to do the work, even simple things. If it is chronic, even simple things he if he do even simple things like walking or lifting from the anything or talking or doing any work, he have low energy levels. Okay, he can complain that he have pain in the muscles are cramping, and he have he have another causes or pain, he will develop pain after the weakness. So this is the generalized fatigue, means low energy levels, means the metabolism is not happening that much that body wants. Okay, so metabolism is not happening correctly in the cells. Okay, so this is the broad, that is the reason broad, narrow, and it is very long thing we have to understood about weakness. So I divided the weakness, what is the cause of the weakness, into three simple steps, three or four simple steps. Already I told in previous class also, but here we will revise. Weakness means low energy levels. Weakness means low energy levels. Patient, it may be mild, it may be moderate, it may be severe. Okay, mild, moderate, or severe low energy levels. So here, what is the cause for the low energy level? So basically, your cell need two things. Basically, he needs carbohydrates. Okay, he need carbohydrates, and another one is oxygen. O2. So combination of carbohydrates and oxygen will lead you development of carbon dioxide, okay, water, okay, next ATP, next heat, okay. So this is the one thing, the after the combination of carbohydrates and oxygen, the cell respiration occurs. In that process, carbon dioxide will produce, hydrogen will, water will, water will is there, and ATP, adeno triphosphate, and heat. So in that, three are utilized by the cell. Three things are used by the cells, and carbon dioxide is eliminated from the body with the help of respiration, respiration transportation. Okay. Water is for cell need water for interstitial fluid or extracellular fluid. Okay. ATP, it is the energy. Whenever cell want to do function, he need energy. Heat, heat for the maintaining temperature of the body. Okay. So here, what happening? One cause is cell is not developing ATP. Proper ATP means carbohydrates or oxygen levels are low. They are not reaching to the cell. Okay, this is one of the cause. If we see in our environment, we have low oxygen levels also. Okay. Okay, in our environment, we have 15 to 20% oxygen is there, but in the cities, we have 15 to 16%. And other than as we have polluted air, means that oxygen is not reaching to the cellular level in proper way, or it is reaching in decreased level. So there's the reason ATP is not producing here. Okay. It may be cause of general fatigue. Second thing is that cell needs carbohydrates and oxygen, which is coming from the blood vessels. Okay. From the from in blood vessels, where it is coming from two things. One is from lungs. Oxygen is coming from lungs, and carbohydrates is coming from digestive system. All the things from mouth to large intestine, from mouth to liver, all the digestive system is helping to get what is the necessary thing. Okay, what is the necessary thing? What is the requirement of the body? It will digest. Okay, it will digest. So there is a problem in the lungs. One thing, it is the cause of fatigue because lungs is not taking proper oxygen, or else it is a problem in the digestive system. The food we are eating is not digesting properly. Okay, this is, in my opinion, this is one of the most common and important cause of fatigue, weakness. Okay, because our digestion is not in doing not proper way, that all the nutritions which are present in our body is absorbing by the stomach. After digesting by the stomach and absorbing by the small intestine and metabolized by the liver. Okay. So these are the things we have to understood. So main cause may be in lungs, it may be in the digestive system. Okay. So this is the one of the second way you can interpret it about fatigue. The third thing, in a simple way, we can understood about the person is having fatigue. That is, cell have three types of, every cell have three types of connection. One is lymphatic connection, okay, blood vessel connection, and one is nervous connection. So already we talked about blood connection. Okay. In the blood, we have to think about lungs and digestive system. And one of the important thing that is we have to think about lymphatic connection because lymph will purify. Lymph is the purification process. Okay. So we need here to think about kidney. Here also blood or blood connection or lymphatic connection. We also think about kidney because kidney filters blood and lymph in the electrohomeopathy. So it is a problem in the kidney, maybe, or else because we have nervous connection. So we have to think about any problem in the nervous connection. The signal is not coming from the brain properly. If we go to the brain cell even have the three types of connection: lymphatic connection, blood vessel connection, and nervous connection. So brain also having any one of this problem. So that's the reason you have or any person have nervous weakness. Okay. So this is the third thing we can understood about fatigue. And the third thing, any organ, if we take the cell, it come under tissue. After tissue, this is organ, but there is any complete problem in any organ of the body. Okay. So we will get the specific type of symptoms when an organ is affected. Okay. Complete organ is affected. Like if the lungs are affected, you will get any type of cough, any type of inhaling problem or exhaling problem. Or if stomach is affected, you will have digestive issues. You can think that the fatigue is due to the stomach issues. If anyone have heart problem, you can understood that this problem is due to the heart. So likewise, you have to take the symptoms and you have to attach to one of the organ. Okay. So from the beginning, what is the cause? One cause I told you that the oxygen and carbohydrates are low. That's the reason ATP is not producing in the amount that what body requires. It may be problem in lungs and digestive system, or it may be problem in lymphatic channels or lymphatic connection, blood connection or nervous connection. And the last most thing is the problem is in the organ. Okay. So these are the four things which are responsible for the fatigue. Okay. And other causes also we have to ask the patient. But in this four, this is one of the cause. Let's see that we have to see other things also. Like patient will have what type of daily living he does, how he sleep, how he take the food, he will doing the exercise, and you have to ask about eating habits and ask about appetite. Okay, and the another cause of generalized weakness is also sexual practices. Okay, more sexual practices leads to weakness, and sleep habits, low sleep or low amount of sleeping in the night maybe cause fatigue. So these are the things you have to ask. Our patient have depression or he have dementia or means memory loss of memory. Okay, that will indicate the problem is in the brain. Okay, due to the brain he have fatigue. And you have to examine the patient about weight. Okay, and you have to ask what type of food he take. Okay, he have the taking the nutritional food or not. You can ask about the liver issues, spleen issues, abdominal issues, or heart problems, or any type of pain in the body, joint pain, neck pain, lumbar pain, or any uh, history of paralysis, or any sort of neurological diseases. Okay, so you have to examine about that. You have to ask the patient if any one of this, if he tell you that my daily living activity is not good, I will wake up at 11 o'clock and do my breakfast at 4 o'clock, and I do my dinner at night, midnight, 2 a.m., 3 a.m. So his daily activities are not good. His lifestyle is not good. So that's the reason he is developing weakness. Okay. You have to ask about that. And other things also we have to determine about generalized weakness. What that is infection, any infection in the body, okay, or any inflammatory diseases like rheumatoid arthritis, okay, and fibromyalgia. These are the common diseases which leads to weakness, or he had any type of cancer or history of cancer, or any psychiatric diseases like depression, anxiety, or metabolic issues. These are the most common nowadays. Metabolic issue, because our lifestyle is not good. We are not doing proper dieting or timing food, exercise, or taking off outside food. Okay, not taking fruits or vegetables. Okay, so it may cause metabolic disorder like hypothyroidism. Now most of the female is suffering from hypothyroidism or hyperthyroidism, and diabetes mellitus is the most common diseases. In from 10 out of 2 members maybe suffer from diabetes mellitus and other diseases also. Okay, so we have to focus about metabolic diseases also, or electrolyte imbalance. Sometimes what will happen in the now summer season is coming, so in that we will face uh, nutrition deficiency most of the patient, or they will have sunstroke. Okay, in that period their sodium levels, potassium levels will decrease. Okay, so in that process also they will feel fatigue. Okay, and nutrition deficiency, not taking iron, B12, folic acid, vitamin C, thiamine, all these are necessary for the body to do normal functioning. We need all these vitamins. So these are the soluble vitamins. Okay, so you need to take daily basis. Daily requirement is there for this type of vitamins. Okay, and neurological diseases maybe. You have to ask all these things to the patient, then you will get one answer from the patient. So that is the reason he had that fatigue. And after asking that, you have to check the pulse also. Okay, or first check the pulse, then ask the patient. If you check the pulse correctly, the answer is correct from the patient. Okay, or pulmonary diseases. Okay, sleep disturbance nowadays, this is also very common. The patient have in insomnia, restless leg syndrome, all these are common diseases. Gastrointestinal diseases, in my opinion, three things are very important: metabolic, sleep, and gastrointestinal. After that, nutrition. These are the four things. The you can imagine that the patient will suffer from any of these four, mostly 90%. Hematological diseases, low amount of hemoglobin, renal diseases, okay, and medication. Excess medications will cause fatigue. So nowadays also patient are taking number of numerous, if he have multiple diseases, he is taking multiple uh, medications. One is diabetic. For diabetic, he have 2 to 3 medicines. Hypertension, hypothyroidism. If he have renal disease, he will take a renal disease, heart disease medicines. Okay, likewise, they are using uh, numerous diseases. So I went to one of my patient. He has multiple diseases from past 15 to 20 years. Okay, he is taking minimum 20 to 25 medications daily basis. Okay. So this is very sad thing for us to, but this is the reality that patients are taking numerous medicines which will cause the side effects of the medications will leads to weakness. Okay, I think you understood about what are the common causes, what type of blood testing you can do according to the symptoms, according to the complaints, according to the affected organ. You have to check the blood reports. You have to tell the blood reports. Basically, we will do if one patient comes to my clinic, okay, he is telling that I have weakness from past 3 days. Okay, along with that, I have neck pain, joint pains, and I am getting thirst rapidly. So weakness plus all these symptoms. So we will advise basic blood testing because of the this is acute, but sometimes the patient will coming from a long period. They have chronic disease and they have all the laboratory reports, which leads you to the one way to treat the patient. But most common, we have to know that CBP will give about anemia, any deficiency, have hemoglobin, or other than that, we have to check the liver, how liver is functioning, and LFT, liver function test, RFT, renal function test. Okay. Other than that, the symptomatic approach, the like that the patient is telling that neck pain, body pain, the pain will in ensuring that you have to check the uric acid levels or rheumatoid arthritis or hypothyroid disorder. Okay, likewise, you have to uh, advise the patient the laboratory tests. Okay, but is purely depend upon the history taking. History taking skills are very, very important. So you have to ask the patient in detailed manner. You have to check minimum 10 to 15 minutes per patient. Then after you have to advise the remedies. Okay. So you can advise the sometimes you have to advise chest X-ray or sometimes, okay, depending upon the test, you have to advise the treatment. What type of treatment you can give in the allopathy? They will approach according to the disease, according to the diagnosis. Okay. Here, one case is giving here. You can see that the, the individual has severe fatigue from more than 6 months. So from more than 6 months. So you are asking daily activities and work first. So the patient will have more than this symptoms like unfreshing sleep, okay, short-term memory loss, muscle pain, joint pain without swelling or redness, headache, okay, cervical or lymphatic nodes, lymph nodes problem, and sore throat. Okay, so these are the simple. One patient came to your clinic. These are the simple complaints, and you have to diagnosis and you have to treat the patient. Okay, if it is more than months, years, and more than they have physical and neurological all complaints associated with fatigue, we will call that problem is chronic fatigue syndrome. In that, physical, constitutional, and neurological, neuropsychological complaints, the patient will complain to you. Okay, so these type of complaints are mostly 75% are women and age between 30 to 45 years. Okay. What are the things you can see that the patient will have fever and other viral illness, and they have type of any depression, psychological depressions. Okay. So this will leads to you the chronic fatigue syndrome. Okay. So in that process, the patient need close observation and mostly we need most experienced doctor to treat all this type of diseases. Okay, let's come to electro-homeopathy treatment. Okay, so again, I will divide into three steps: mild, moderate, and severe, or acute, subacute, or chronic. So if the patient comes with you mild symptoms, you have to ask the history from beginning to ending. What are the things I explained here? You have to ask. So I will take one thing. He complained about weakness, and he's telling that I have abdominal pain or a loss of appetite. Along with all this, he have loss of appetite. So this leads to me that the patient have gastrointestinal problem. So I have to treat that problem also along with fatigue. So the most important and you have to check the three things what in the beginning I explained. It may be lymphatic connection, nervous connection, blood vessel connection, problem in the lungs, problem in the uh, blood vessels, which are taking the carbohydrates and oxygen, or our cell respiration is not doing well. So it is maybe one of the cause. So you have to basic treatment is S1, A3, WE. Okay, this is you have to give in D5. Okay, and another one is I told you that along with that the patient have abdominal issues. You have to treat the abdominal problems. So you can go with S10, C10, WE. Okay, because S1 is also working on abdominal digestive system. S10, C10 also work on intestine and absorption of the intestine. Okay, and you can give is D5. Okay, so you will give this remedy in the basic first stage. Okay, you have to take 15 to 15 days or more than 1 month. Next, we have phase two. The patient have moderate type of weakness. He is telling that along with that, he have headache and less sleeping hours. So it indicates the patient is in depressive or psychological condition. So which leads to headache, okay, along with weakness. Okay. In that condition, we have to add F1, L1W because lymphatic channels are affected here, in my opinion. Mostly headaches causes due to the proper uh, reach of lymph to the brain. Okay. And another one is S10, F1, WE. Okay. Here also you have to add to increase the metabolism of the brain, to take the carbohydrates, oxygen to the brain. Okay, we have done S10 F1W. Here also you can use D5 or D4 according to the condition. And the third important thing is F2WE to apply on the forehead. Okay. And the fourth one is C1 S10W to improve the cellular level metabolism. Okay. So you can add all these four formulas in the moderate condition due to the head depression or insomnia. And the third one is severe severe fatigue needs laboratory test, like the patient is in the on the laying on the bed, unable to move his hands, and difficulty in talking. All this indicates that the patient has severe fatigue This condition needs close observation, laboratory test, diagnosis. Okay, so but you can start the initial treatment along with after the reports will come, diagnosis will done. You can start the treatment along according to the condition. So, but first you can start with C1 S10WE. Here you can give into the start with D6. Okay, D6. This is the best. Again, S1 A3 WE. Okay, or RE also. S1 A3 RE also. Okay, in D6. Next, S10 F1 WE D6 and F2 WE. We have to apply the top of the head, or else if any problem, according to the condition, you have to add the electricities. Like in the previous class, we studied about electricities. Right side problem, RE, left side problem, YE, middle WE, on the heart BE. You can apply. Or on the spine WE, or REB, REY, sorry. And you can go to the in the severe condition, most of the cause is infection. Okay, the patient will develop infective cause is also one of the reason. Here you have to treat according to the cause. So here you can add S10 F1 A3 also, or S10 F1 RE also may be required. Okay. So in my opinion, so you can try this basic treatment, but again, history is most important. You have to take the history and you have to treat the patient. So I hope you understood about fatigue generalized weakness. Okay.